Different types of SLP settings. Which SLP setting is best for me? It can't be said enough. Speech-language pathologists are so much more than just speech. Our scope is broad, which means we can be found almost anywhere, not just schools or private practices. So which settings can SLPs work in, and how can you decide which setting is right for you? While there are too many to cover in this one episode, let's start by breaking it down into 3 categories. Let's dive in.
I'm Theresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the MedSLP Collective and MedSLP Education.
Category 1. Adults versus pediatrics. This is usually the first decision point for many SLPs, which of course can change over time. SLPs can work with the entire lifespan, from infants to end of life. One common response I get when I mention infants is, "But babies can't speak. What would a speech therapist be doing with an infant?" And the answer is easy. Feeding. SLPs can help infants who are born prematurely with craniofacial anomalies or may be born with a syndrome to help develop their suck-swallow patterns and teach parents positioning and feeding strategies to best support their tiny one. SLPs can even do video fluoroscopic swallow studies with infants. You might find SLPs working in a NICU, private practice, or home health to support parents and their newborns. The roles of an SLP expand as the child grows and developmental milestones are being met. For clinicians who want to work with toddlers or older children, they might find themselves working in a private practice, school, pediatric hospital, pediatric rehab clinic, or outpatient center teletherapy. Whether you want to focus on language development, speech and articulation, feeding and swallowing, cognition, or all of the above, a variety of pediatric work settings are out there ready to provide you with a bunch of kiddos who need your services. Going beyond young childhood, maybe you love the idea of serving teenagers. Providing services in high schools, outpatient clinics, or even vocational programs that offer our services can all be wonderful environments. Our services can help set students up for success in college and in the work environment. Maybe you don't want to work with children or teenagers. That's totally okay. I started out working with children and realized that this population just was not a good fit for me, so I transitioned to working with adults. Working with adults can mean anyone from 18 years old up, including our 100-plus-year-olds. The work settings are endless, from specialized clinics to hospitals to nursing homes and assisted living facilities, even hospice. I personally enjoy working with older adults in skilled nursing facilities. Those are my people. When I first started out as an SLP, I did my clinical fellowship in the schools. I thought for sure I wanted to work with kids. I had a pretty tough clinical fellowship year with having a change in supervisors and a really high caseload, but I thought it was just something I would work through. My CF supervisor also worked in a skilled nursing facility after the school day and encouraged me to go with her one evening. I thought for sure I wanted nothing to do with the medical side, but I ended up loving it. I quickly fell in love with dysphagia and found it so impactful what she did with video fluoroscopy and modifying diets and doing swallowing exercises. I continued to shadow her for a while until a position at that skilled nursing facility opened up after I finished my CF, and I was able to make that transition with continued education and mentorship, and I've never looked back. One thing I've always appreciated about our field is the wide variety of settings and populations we can work with. I know burnout is so real, but there are so many different settings and populations that we can explore if we need a change. I'll be posting other videos just like this one that you won't want to miss, so make sure to hit that like and subscribe button and turn on the notification bell. Category 2, short-term versus long-term, or maybe you can think of it as fast-paced or slow-paced. One thing I didn't really consider when I first started out was how this setting can affect how long you work with patients. If you work in an acute care setting, for example, you could see patients anywhere from 1 day to a couple of weeks, and your sessions will likely not be 60 minutes long. They tend to be shorter depending on the patient's needs and healthcare status. SLPs in the acute care setting get to dive into the assessments and help put the first pieces of the puzzle together with the medical team. This can look more diagnostic than treatment-focused at times. If you're someone who likes rapid change, then acute care might be a good fit for you. It's a setting that can keep you on your toes and give you new problems to solve each and every day. You can also collaborate with interdisciplinary team members easily and often, especially if you join rounds to discuss each patient's case on a particular floor. However, if you thrive more in long-term treatment sessions, building strong relationships with your patients, and want to see them meet their long-term goals, you might want to consider the longer-term settings. These can include rehab settings, nursing homes, private practice, or home health, just to name a few. This is where you can have a more consistent caseload of hour-long assessment and treatment sessions. You'll also have greater access and ability to use standardized assessment tools and a variety of therapy tools. With the longer-term rehab settings, you get a bit more flexibility and freedom with your treatment planning. Also, there's something special about building longer-term relationships with your patients and clients. These settings are great for people who like slow and steady routines and want to build longer relationships with clients. I personally loved working in the skilled nursing setting. This allowed me to actually see the progress being made, goals being met, and it allowed me to build stronger relationships with the residents as well as the rest of the medical staff. I enjoyed having more time with my patients and really getting to know them on a deeper level. Some of my most fulfilling moments were having patients come to the skilled nursing facility post-stroke, still on a trach, in a feeding tube, and being able to work with them for 2 to 3 months to rehabilitate them back to a regular diet. The relationships with those patients and their families had such a profound impact on the work that I want to do in this field. Category 3, private practice versus being an employee. Another way to differentiate work settings is business ownership. Do you want to work for another employer, or do you hope to one day create your own private practice and just serve specific patient or client populations? If you're someone who thrives on structure and being given directions, working for another business might be the better choice. The pros of working for someone else is the reduced decision fatigue, the structure, and the ability to simply clock in and clock out. So you can just focus on non-work related things when you leave the building. Some things that SLPs might not like so much when it comes to working for employers is the limited time off, potential lower pay, lack of control over your caseload, and bureaucracy. Owning your own practice can give you the freedom to pick your work hours, choose your client population, and even give you an opportunity to earn more income. Potential cons of owning your own practice can be the increased responsibilities of business ownership, working directly with insurance companies, and spending more time in an administrative role as your business grows. For me personally, I have enjoyed the experiences from both sides of the career table. As an employee, I liked having my days mapped out, a team that was already accessible to me, and the ability to just clock out at the end of the day and leave work at work. What I didn't enjoy, however, was the decision-making bureaucracy and barriers to accessing instrumentals and other important assessment and treatment tools. As a business owner, I love having the freedom to create what I want. When I own my mobile fees company, I love being able to manage my own schedule and fiercely advocate for other SLPs and patients who needed instrumentation. There are challenges that come with being a business owner, though. It can be very time-consuming, especially in the beginning. It's tough to create boundaries between your work and personal life, and it's easy to become overwhelmed with the business knowledge and skills that you have to learn because, well, I went to school to become an SLP and I wasn't a business major. Ultimately, it comes down to what your goals, values, and financial situation are when you choose between working for others and working for yourself. There's no wrong or right answer, just what's the right fit for you. If you're interested in the medical side of our field, whether that's pediatric, adult, short-term, long-term, or as a private practice or business owner, check out our thriving medical SLP community over at MedSLPcollective.com.